Hello, everybody, and thank you for being here tonight, or today, excuse me. We are here to talk about the health and well-being of medical providers. And my name is Chelsea Norris. I've talked with some of you before about registering for the webinar and the course, and you may have gotten some communication from me. I'm the program coordinator, and so I take care of many of the logistical aspects of the course that we'll be talking about. With me here tonight is Dr. Peter Yellowlees. Would you like to go ahead and introduce yourself?
Sure, it's very nice to be here, and thank you indeed, Chelsea. And I must say I'm delighted to be able to talk to all of you, and hopefully some of you will do this course. I'm a professor of psychiatry here at UC Davis. I'm also the chief wellness officer, and I've been involved in the area of physician health and well-being, as well as the health and well-being of other medical providers for quite a number of years now. So I really look forward to teaching this course and hopefully to meeting several of you.
Great, thank you. So before we go ahead and get started with the meat of our program today, I want to just take a second to remind everybody that this is really your session. So the goal of today is for us to be able to answer any questions that you might have. And so there's a dedicated time at the end of the information session where you can chat, use the chat or the question functions, and we will get those questions and we will answer them for you so that you can decide if this is a course that is appropriate for you to take and something that you're interested in. Dr. Yellowlees is also going to be talking about physician and clinician burnout today to kind of give you an idea of what you could expect in the class and the topics and give you some information to work with before you even start taking the course. So with that, let's talk a little bit first about what we are going to go over. So like I said, Dr. Yellowlees is going to talk about clinician burnout, and then I will jump back in and talk about the course structure, what you can expect taking the course, what does it look like, what's the time frame. And then I will talk about the finances aspect of the class. There'll be a dedicated time for questions. And then at the end, I have all of our contact information and registration information for the course. So let's go ahead and get started.
Good. Well, thank you very much indeed, Chelsea. First of all, two disclosures, which actually are very relevant to the course. These are the two books that I've written on this topic. Physician Suicide Cases and Commentaries is actually the core book for the course that you'll need to have to be able to run through the course, and it has a lot of the content on it. The other book, Physician Wellbeing, is something that I certainly think would be very helpful for you to have. It focuses more on prevention and on changing health systems to try and improve the lives of different providers. And next slide, please. So this is what the basic problem is. We know that physicians in particular, but also clearly other healthcare providers, have excellent mental health at the time that they start their training. So if you look at data on physicians, as you can see in front of you, physicians actually have less burnout, and you see them in blue, and less depression than age-similar college graduates entering other graduate programs. So that's on day one of medical school. Physicians are extremely healthy and certainly healthier than equivalent PhD students. Next slide. So what happens? Well, actually what happens is very sad in many respects. We know that within 2 years at medical school, that physicians have much higher levels of burnout than equivalent graduate students. We know that by 10 to 15 years, the levels of burnout are about twice the extent of equivalent community controls. And that ultimately about 50% of US physicians experience some sign of burnout. We also know that about 80% of burnout is really caused by organizational factors, because as I've already mentioned, physicians in particular are very resilient people. They have to be to jump all the bars to get into medical school. And what other things also affect physicians? The two big other issues are depression and suicide. Tragically, 400 physicians suicide every year in the United States, and suicides from female physicians are actually twice the level of their colleagues in the general population. So it's really quite bizarre if you think about it. If you have a female physician talking to a female patient who's the same age, the physician statistically has twice the likelihood of killing herself. And then the final thing where physicians are different from the general population is that on the whole, their choice of drug is to take alcohol. They also tend to take more prescribed drugs if they're going to take any types of non-alcoholic drugs, and they tend to keep away from street drugs like meth. And the next slide. So overall, is a review of the 5 major sets of health issues that affect clinicians. The first is burnout, which I'll talk about a little bit more in a minute. The second is disruptive behavior, by which I mean really behavior that is antisocial. That leads to people to be essentially I guess difficult in social situations, difficult in committees, tends to be reported by their colleagues rather than by patients. And whilst this used to be acceptable in health systems, and the stereotype is the surgeon who throws scalpels across the operating, it's no longer acceptable at all. Thirdly is aging. The whole physician population is aging. About 40 to 50% of physicians are now over the age of 50. And we need to try and work out how best to work with aging physicians who may still be practicing very, very actively, but who, once they get to be 70 years old, have about a 5% chance of developing quite significant cognitive impairment, as have the whole population. We need to have a way of making sure that physicians are still practicing safely when they're more senior. The next, obviously, set of issues are the general psychiatric disorders like anxiety and depression and post-traumatic stress. And then finally, physicians have substance use disorders, as I mentioned previously. Moving on to the next slide. So burnout, just look at this very briefly. Burnout essentially consists of 3 types of symptoms: emotional depletion, detachment and cynicism, and a sense of low personal achievement. What this means ultimately is that people tend to think of their patients as being numbers or items rather than as being so human. They tend to feel that their work isn't worth doing, that maybe they should be moving elsewhere and that the grass is greener elsewhere. And they tend to become cynical and rather detached and less sort of friendly and warm in the workplace. So all of these things lead to a number of consequences, and we'll look at those now. Next slide. Why do the physicians get burnt out? They get burnt out essentially because, as I mentioned earlier, primarily because of organizational issues, high workloads, particularly workflow inefficiencies, and increased time spent in documentation. Now, obviously, what that leads to is a loss of meaning in work, this social isolation, and often a cultural shift from health values to corporate values. And that all has significant repercussions at both a personal and a professional level for physicians who are burnt out. And the next slide. And so when you're looking at this slide, don't just think of physicians, obviously. I mean, we're talking about all medical providers, all clinicians, and all clinicians are affected by burnout. Now, in many people, and the majority in reality, burnout is a self-limiting set of symptoms, and something happens and people improve over time, having maybe had a bad 6 months. But during that time, they may have had significant impairment in their relationships. They may have started drinking more alcohol or using drugs. And of course, the burnout may continue on and lead to depression and potentially even to suicide. So there are significant personal consequences of developing burnout. Now, in the past, we always used to think that was the main issue, that it was not a good thing from a personal perspective. But research over the last sort of 10 years or so has really started to demonstrate very clearly that there are major professional consequences of being burnt out. And this includes decreased quality of care, increased medical errors, impaired patient satisfaction, reduced productivity and professional effort from physicians, leading, not surprisingly, to greater physician turnover, which is a very expensive thing for all health systems, and actually can be quite destructive for the physicians themselves if they're going to a new system just because they're trying to escape the old one. So burnout's a big deal, very important that we learn about it, and certainly in this course, one of the foci of the course is how do you in fact prevent burnout, how do you modify the system and change the system so that clinicians are not so adversely affected. Next slide. So where do we go from here? Well, obviously, you know, it's a good thing for you to hopefully register for this particular course. The course originally was set up mainly for physicians, but the reality is we've had other non-physician providers take the program in the past, and they've found it enjoyable and have done well. So we're directing the course very much to any clinician from within the healthcare industry, or any individual who has a reasonable contextual knowledge of or experience in the health system environment. We're clearly not going to be teaching people about what health systems are. We're going to assume that basic level of knowledge, and we're going to be looking very much at the work experience of clinicians within the healthcare environment. Now, we've run this course last year, and if I could have the next slide. One of the students from next year, in fact, Dr. Nakagawa, who's a physician fellow working with me here at UC Davis, is actually going to be working with all of you on this course. And this is one of the things that he said after he had finished this course. I now realized I'd experienced episodes of burnout, but didn't have the self-awareness or the knowledge to realize it was burnout, and just tried to push my way through it. During this course, I learned from experts and read books and papers that helped me build a solid foundation for evaluating physician burnout from an academic and practice-oriented lens. So Dr. Nakagawa is you know, a very interesting and erudite physician, and he and I will be jointly teaching the course together. So I'm going to pass back to Chelsea now, and I look forward to your questions at the end of this session.
Wonderful. Thank you very much for going over all of that with us. And so the point of today is to give you a teaser about what you might be learning. And now let's talk about how you can do more of the learning and the course that we have to offer you. So the health and well-being of clinicians is a course that is offered from February 24th to May 4th. It's a 10-week class. As Dr. Yellowlees talked about, it's co-facilitated, so you'll get both of them working with you in the class. It's completely online. You do not ever need to come to campus. You can take it wherever you are, as long as you can access the materials every week online. We use a program called Canvas, and that is our class management program, and that's how you will access recorded lectures that we have for you, the reading assignments, quizzes, and discussion posts as well. We expect students to contribute to discussion boards, and so this is a way for you to network with each other, to learn from each other, to share different experiences and points of view, and so it's a very important part. And there'll be a discussion post or a board that you are required to do every week of the course. You also need to achieve an 80% completion rate on 6 of the quizzes. So that is what you need to do to be able to pass the course and complete all of the course evaluations as well. So I have a couple of slides that I'd like to show you because some folks are new to Canvas and aren't quite sure what to expect taking an online course. And so I have a couple of screenshots to show you. So this is what Canvas looks like, and this is our course from a previous quarter, but you can see the weekly topics that we have listed there, and we have the syllabus and everything that you might need for the course in Canvas, and this is how you will access all of it. The way we do it is breaking it out into modules, and so there will be 10 modules, 1 module per week, and in those modules you will see reading, you'll see the discussion post, you'll see the quizzes, and then you'll also see the recorded lectures. And the recorded lectures look like this. So this is the one from, I believe, module 2, and you will see that it is a recording there. You can also get the transcripts. So if you are somebody who would prefer to read the information, or if you would like to watch it first and then read it, we have both options there for you. It's all embedded within Canvas and tends to be pretty user-friendly for our students. We also, Dr. Yellowlees has also provided additional resources each of the weeks. So the book that he has written that he talked about at the beginning follows along and goes with the course. And then he also posts additional readings and resources, because if you're taking this class, he understands that you're interested in the material and are looking for additional points of view and additional research and things that are out there that can give you more information on this topic. So let's talk about the finances piece. The fees, it's a course fees, one-time fee for the course. It's $800. The book is not included. We do offer some financial assistance that you can see listed there, and the link at the bottom of the slide is where you can go to see what we offer for different types of loans and assistance with financial aid type programs. And what I'll do is, we're actually recording this right now, and I will be emailing a recording out to everybody with important links like that you can click in the email, so you can easily access those to get to get additional information if you would like. So now we'd like to answer any questions that you might have about the course. I'm sure Dr. Yellowlees would answer a couple of questions about burnout as well, if you have something that you feel like you would like answered. Do we have anything coming through yet? Not just yet. Okay. I did have one person has asked me in the past, they said that they are a nurse, so they're not a physician, but they're a nurse. Do you think this course would still be appropriate for them?
Absolutely, there's no question about it, and we've had nurses do this course before. As I say, I think it is important to understand the general context within which healthcare occurs. And so I wouldn't advise anyone who's never worked in a health system before to take this course. But I think there's no reason or why, if you're a nurse, if you're a student, within a clinical area in particular, or if you have a primarily administrative or financial role, again, there's a lot that you can learn about your colleagues from doing this course.
Thank you. Someone's asking, what are the weekly expectations? How much time should they plan to spend on this course each week?
So I think most people spend probably about 2 to 3 hours a week. That's a reasonable amount to expect. There's about half an hour's worth of video recordings in total each week, which are essentially the lectures. There's one chapter in the course textbook, which generally probably takes about half an hour, 20 minutes to half an hour to read. And then, there's more readings if you wish. You can clearly spend more time than that if you want. The quizzes themselves are very quick. They don't take long to do and are fully automatic. What we encourage people to do is to ask questions, to interact with both Dr. Nakagawa and myself, and clearly with all of the other students doing the course. And we find that if it's possible to have an interactive course where people are really working as a group, that actually there's a lot more good education gets done in that process. So we try to be interactive. But you should estimate 2 to 3 hours per week. And if, of course, the reality is some people will be away maybe for a week or two, holiday or other reasons they can't appear at different times during the course. That's perfectly okay. Just tell us what you're doing. And there's no problem about catching up or anything like that. The course resources are always there anyway, so you can always go and do them a bit later on if you miss a week.
Great, thank you. And another person is asking about units or academic credits, or what kind of credits we offer. So we offer 20 CMEs for this course. That's what you would earn. It's not the academic credits, but the CMEs is what we offer. Anything to add on that piece?
Yes, it isn't a course that counts towards any formal degree. Everybody gets a certificate of completion, so it can certainly go in your resume. But it doesn't attach to other formal, masters or equivalent programs.
Thank you. And the last one that I'm seeing is, so you don't have to be a physician, but you do need to be familiar with healthcare and the organizational processes and structure of healthcare. Are there any other prerequisites that you would think folks might need?
I really don't think so. I think a lot of it's very self-explanatory. We're really talking about, the human workforce within a particular environment, and most people have a pretty good understanding broadly of how hospitals work, how clinics work, and many students will have picked up a lot of that information from various different TV programs, quite honestly. So I think you need to understand the context of healthcare broadly, but not the detail.
Okay, wonderful. I'm just double checking. Kirsten's answering a question. Anything else? No. Okay, so there's still time if you want to still type in a quick question, but I'm going to move on to the next slide so that you can have our information. Here you can have the email addresses for myself or for Dr. Yellowlees if you'd like to ask him a question. That's my phone number that's posted there. Again, I'm happy to answer questions. If there's something that I cannot answer, I by all means will reach out to Dr. Yellowlees to get the correct answer. The course registration link is there, and then you can also join our CPE Health Sciences or Dr. Yellowlees pages on LinkedIn. We'd love to see you there. And again, we're recording this, and so when I send up the follow email, I will have those links easily clickable for you to just be able to hop right on there and get all of that information. I think we got them all. Dr. Yellowlees, is there anything else you would like to say in closing?
No, I just hope that several of you are able to come and do the course, and I really look forward to meeting you.
Great, thank you. Yes, this is a very important topic, and so we are excited to bring this class as a resource to everybody out there, and help us spread the word as well. If you know folks who might like this course or find it valuable, you're welcome to forward any of my emails onto them. We are trying to get a good set group in there so that you all can have good discussions and hear from many different points of views and experiences, and so that's a key aspect of the course. So we're excited to see you in class, and we recommend getting registered soon, and again, you will receive a follow-up email from me. So thank you very much for being with us today. I know all of your time is incredibly valuable, and so we appreciate the time that you've taken today, and we look forward to seeing you in class. Thank you.
Thank you very much, everyone.